I will vote to proceed forward, but I made the pitch today that this shouldn't be the end of the debate. By Thursday, I hope to have legislation that people can look at in terms of what a block grant would look like. So I'm reaching out to governors. I'm trying to take a new approach here. What if you had political support from Republican governors and maybe some Democrats, but start with Republicans and the president? When you go back home, there's not much support for this bill. I haven't had one person come up to me and say, let's vote for the McConnell bill. I do believe Republicans would be very intrigued with the idea of taking the money and sending it back home, being generous with money, but having it spent back home on innovative ways of delivering health care. Federalism will sell on the Republican side, and I think some Democrats would have a hard time going to their states and saying that we don't want you to get the money, we want somebody in Washington. So we'll see. I think the plan is to take a vote on repeal and replace in 2 years. I don't know how that vote turns out. What I'm doing is trying to offer an alternative. I think we owe that to the public. You know, Obamacare is collapsing. The reason we're having all this upheaval is it's just not working. 1 in 3 counties really have one provider or less. But we do owe an alternative to the country at large. And my alternative, to me, makes sense to me if nobody else. Take all the money and power that you're going to spend in health care and send it back closer to the patient.
Would you like to see more from the president on this?
You know, I'd like to see a bill that people actually liked. I gotta go.